Senior VP, Lincoln Communities. On behalf of my friends, my colleagues at Lincoln Communities, and my co-developer, Errol Abdullah, would you please stand up, please? You know, anything that's really important, it requires having great friends and people willing to commit to make it happen. This doesn't happen without Errol. Thank you. Welcome. Okay, so I've already told you who I am. We're going to keep the program moving. We're going to actually bring one of our, well, from an economic perspective and from what I think people will see and the benefits that we're going to deliver to people for a long time, the key partner, which is the East Liberty Family Health Care Center. I believe Dr. Hall is actually one of the founders of East Liberty Family Health Care Center, and he's going to come up and offer a few words to us. Please, Doctor, come this way.
Hello, everybody, and thanks for coming. What a great presence, a great cloud of people. So I'm delighted to be here at the new home of the East Liberty Family Health Care Center. Welcome to this event as we celebrate this achievement. We started. We started actually 40 years ago in the basement of Eastminster Church, and now we're on the top of the hill in a beautiful, beautiful space. Much to celebrate, much to give thanks for in our new home. We especially appreciate the funding and the support we've had. We had support for the R.K. Mellon Foundation, Hillman Foundation. We had NAP contracts for UPMC and PNC, and overall $2.8 million for us just to have this new space. So we really appreciate the support, and I really appreciate the public servants, the city, county, state, and really working hard to make healthcare, primary healthcare, affordable for East End Pittsburgh, and for accessible and affordable, and serving the neighborhood and doing quality health care is really at the core of our mission. Since 1982 when we started, trying to show God's love by providing quality whole person care to the underserved, the uninsured, and the underinsured is really the heart of our mission. And this, we have a full-time chaplain, Dr. Dave, will open with an invitation.
Well, glory to God. Am I the only one that's happy to be here? Amen. Amen. I feel blessed to have this building. So let us pray. Gracious God, on behalf of the East Liberty Healthcare Center, Beacon Communities, the Lemington Senior Center, the many leaders in attendance and those from the community, we thank you, God, for this opportunity, calling your people to this ribbon-cutting ceremony for the Lincoln-Lemington building. We thank you for each and every one who is here today. You have blessed us at East Liberty Family Health Care Center and Lemington Senior Center with the opportunity to serve those who enter our buildings sick, seeking spiritual care, physical healing, and a place to live. We pray to you, God, that you continue to care for the sick, the tenants, and the staff. We ask you to continue to guide us and bless us here in this building. Our God, we thank you for being with us today. May we follow the lead of the Holy Spirit and be a holy people, consecrating and blessing this location as a holy place. Thank you, God, for always being there to support your people. We thank you and we praise your holy name. Amen.
It's a huge deal. And so we're going to go over some detail of that in a moment. Not super detailed, I'm not going to bore you. I'll make it rapid fire. But we're also going to take a few minutes to talk about sort of the beginnings of this, which takes us back to 1877.
Yes.
That's a big deal. Wow. I was thinking about it earlier today and last night, and you get emotional thinking about the work that people did when they literally had almost nothing to work with and they figured it out. And I think about, gee, we have public entities and all these various types of resources to make great things happen. We have a responsibility to make something great happen, given the resources that we have compared to Mary Peck Bond's era. So we're going to take a few minutes to talk about that. So first, some facts about what you're sitting in. The property, as you all know, at one point, well, starting in 1982, it was the Leamington Home for the Aged, a 192-unit nursing home center on the above floors. The ground floor had community engagement work, including health care, all kinds of really great stuff. It was an amazing thing. And sometimes great things trip. And so the building, it did not work after a period of time, and it sat vacant for 15 years, on the order of 15 years. And so Errol and I put money together, went to Dollar Bank, got a loan, and acquired the building after we got an award from the Housing Authority with the project base. Because in my mind, if we got that, and we can for sure put the rest of it together. So that was like a leap of faith, and it came together. So what do we have? On this ground floor, this room is on the order of 1,500 square feet, community space for the 54 folks who will live in this building. All 54 of those apartments, which are created on the 2nd through 4th floors, set aside for folks of modest incomes. What does that mean? They're all folks who are going to benefit from the Housing Authority's project-based voucher program. So without the Housing Authority, there is no program. But that was really the vision, to essentially create something that was an extension of the Section 202 project that is just to my right, your left, the EVP, creating a campus for folks who are of modest income living in a predominantly African-American community. That was our plan, that together with bringing services to this community. Services. Dr. Hall, I actually remember the 2 times I went to make my pitch to the board, and they asked very good questions. So that's all fine. Happy to answer good questions, because we're actually motivated to do great work too. And when we find people who are of a like mind, it's wonderful when you can link up together and create something great. So, out of those 54 apartments, 48 of them are set aside for folks who have mobility, special mobility needs. And the idea behind this is so that people can age in place. Time goes by, you need a little assist in your bathroom, or maybe a roll-in shower. All those sorts of things work better for you. So that's what's in this building. We have, besides those physical attributes, you haven't had a chance to see it yet, how many 54-unit apartments have 2 elevators? This building has 2 elevators, so the seniors won't have to wait too long waiting for the elevator. So that's a great thing. So we're able to provide for our people a place where you can move in, live within your means, and as your needs change, the property accommodates them. If you happen to, over time, you need your doctor more often. Well, you got that right downstairs, okay? And suppose you need to see a dentist. Dr. Hall, you undersold. They have 6, so I did get a chance to get a tour. So 6 dental chairs or stations. But I don't remember how many primary health care doctor offices and behavioral health, all of that in this space. That's a wonderful thing. It's an incredible resource. So here we are. We have this great resource for our folks so they can stay in place and be comfortable and within their means. And so how do we put all that together? Well, there's lots of fancy financing, and we're going to get to that in a moment. But in general, we worked with the URA to acquire a tax-exempt bond allocation. So, and with that came these 4% tax credits. And that coupled with the Housing Authority's $3.9 million. $3.9 million in addition to the 54 project-based vouchers that were provided. That's a community. I mean, that's all of our public partners leaning in. And Allegheny County, we had some special problems at the end, came through in a way that isn't normal, right? But we didn't have a normal situation. And even though the project overall is over $17 million, the last $225,000 is very important. And they came through. Thank you. It's a big deal. And then finally, our first mortgage lender, which the East Coast had terrible weather, and Redstone Partners was rained out. But they bought the $7 million tax exempt bond, which will ultimately become a $4.6 million amortizing loan. So we have this intricate, complex financing stack. It's just what it requires to bring this sort of resource together. So I'm happy that we're a part of bringing that together. You know, essentially, in reality, I guess a band needs a band leader. That's our job, right? We're the band leader, pulling all the pieces together. So, that's the overview of the project. Now, next, quick time, Mary Peck Bond, the founder of the Lemington, I want to make sure I get it correct, Lemington Elder Care Services Group. We've shared some of this information with many of you, but in 1877, this woman who was originally from Philadelphia moved to Pittsburgh, through her church noticed a woman who was living in a basement. And she and 4 of her friends decided that that just wasn't right. Something had to be done. And they responded. First, they took care of Aunt Bonnie, Aunt Peggy in their own homes. They began to see other people, and they bought a house on LaPlace Street in the Hill District, and were taking care of 6, 8 or so folks for a number of years. And then by July 4th, 1884, is when they established, that group established the organization that ultimately became, the Lemington Residential Corporation, which soon after 1884 built a new center on Lemington. So it's actually, I believe it's the building beside the Lemington School.
It is. It is.
That's something. That's amazing. We should celebrate that. And somebody's got to save it. I'm sorry, I can't do that one. But it's a great, what a legacy we have here. And I'm happy that we can take the time to celebrate that right now. And thank you to, Councilman worked hard for us. The street is named for Mary Peck Bond. That's the least we can do. recognizing the courage, the grit. I mean, we overcome things now, it's a fact. But it's nothing compared to what those ladies, those folks had to do 130 years ago. Wow, it's amazing. So that's the short shrift for Mary, but we wanted to take some time to share her story with you. And now on to our public partners who've been so good to us right from the very beginning. We're going to start with State Senator Lindsey Williams, who was an early and enthusiastic supporter. I remember talking to you about it on a few occasions. Thank you for your support for this building, and then ultimately, by the end of the fourth quarter, so December, I think we will have our solar array in place. That solar array is going to be funded by RACP funding. Did I call it right? RACP, RACP.
That's close enough.
That's close enough. So close enough. So Senator Williams, please come up and offer some words.
Thank you, everyone. It's nice to see a full house. I'm Senator Lindsey Williams, and I have the honor of representing Senate District 38, which we are sitting and standing in right now. I'm thrilled to be here celebrating this wonderful project. And like Michael said, it was one of the first projects that got brought to me as a newly elected senator. And it was clear what this could be, and it's exciting to get it, to see it move from planning stage to this beautiful building that we're in right now. Incredibly and proud to have supported this investment in our community and the people who live here, especially our seniors. The Lemington is going to provide much needed housing for them, and affordable senior housing is so important for our neighborhoods. It allows people who have dedicated their entire lives to our community to remain in the community that they love. And it frees them from having the burden of caring for a whole home, which can be expensive and a huge barrier. And like Michael said, this place can grow with them. And that's so special. In addition, having the East Liberty Family Health Care Center right here, providing access to quality health services is just, I don't know where else you get that in the city. It's just amazing. And the Family Center's mission of providing whole person health care cannot be talked about enough in the world we live in today. I mean, we're still wearing masks, and we need those services, and we need that specialized care for top medical, dental, and behavioral health services. And as we're working our way out of the pandemic, the care of making sure that we care for people who have long COVID or who have lost someone, that's so important to have that just right next door for the people who live here. So thank you for everyone who's been a part of this project, and I'm glad that I got to be a very small part of it. Thank you.
Thanks again, Lindsay. So our next speaker is an advocate for community development efforts really all over the county. A lot of times these projects include these adaptive reuse type projects, and sometimes they include things that require special infrastructure support, and this is just one of those cases, but a stalwart supporter of the work that we're doing. I wouldn't say it if I didn't believe it. So Rich, would you come on up, please?
Well, thank you, Michael, and congratulations, and thank you, and congratulations to you and Earl for stepping up and being willing to do something that needed to be done. And when you think about some of the history that you mentioned, going back over a century and a half, right here in this very, very site, and all the work that was done is really, really, really special in so many ways. The senator, talked about it, but I want to tell you, these projects are very competitive. And we, and the senator, whether it's Senator Costa or myself or the mayor or myself, we get literally dozens and dozens of projects that people come forward with, but we can only fund a small amount. And that's just unfortunate. That's the realities of budget, whether it's the tax credit program or the RCAP program. So the fact is, this had a lot of support because it was the right thing to do. And again, I just want to congratulate all the folks who came together to put this together, because these projects are very competitive. We thank our friends from the state for providing the tax credit program and the RCAP program that we're able to access locally. The other thing, you talked about the Mary Peck bond in the late 1800s, but one thing that jumped out at me that people should be very proud of, that the Lemington Elder Care Services was the first home in the United States to address the health care needs of elderly black women. Yes. So something we should all be very, very proud of, that it happened right here over 100 years ago. When you think about the people that helped build these communities, that's who we should be taking care of, the folks that did the work and provided that. And then when they get to a stage in their life where they're going to need some services, whether it be medical or social, behavioral health, whatever it might be, that we're there, pharmacy, dental, that we're there to provide them. The other thing I'm always excited about, and I know we're in the mayor's former House district that he represented for so many years. And if you see the order of how we speak, the way it always works is federal goes first, then state, then county, then municipal. So I am so delighted that I get to speak before Ed Gainey. Because one of the toughest things I had to do when he was a state rep was to speak after Ed Gainey. But I know he's a huge advocate of obviously this community that he represented for so long, but also affordable housing and affordable units that can be provided, 54 units for people to be able to afford to live in their neighborhood where they grew up. So Michael, congratulations and thank you.
You're welcome and thank you. Next on your program is Mayor Ed Gainey. So as County Executive said just a moment ago, when we started this process, Mayor Gainey was the state rep for this area. And he was one of the early phone calls I made, because even though the resources were primarily controlled, at a city level in some county, I knew it was important to reach out and begin to build relationships in the community. One of the first meetings I had was actually at the Paulson Community Center. And it was a good meeting. Again, people ask challenging questions, but that's okay. The Paulson Community Center on a Saturday morning. And so Mayor Gainey, you've been a strong supporter for us all along. We're going to actually need your help going on, because the reality is that when you serve people who have at risk, the systems don't always support people in the way they need. We're always calling on our public partners to help us, because we create these things so that we can have a real safety net. And so I appreciate the support that you've given us today. Look forward to building on what I think is a really good relationship already. And so why don't you please, would you please come and give us a few words this afternoon? But thank you, sir.
So Mike is being modest. Right, so let me put it in perspective. I've been knowing Mike for approximately 20 years. And a lot of times in this city, if I'm gonna be honest, a lot of African American developers don't really get the opportunity to demonstrate how great they are. And every project from the one in Oak Hill all the way to today, he's done a phenomenal job. So when he called me, it was a no-brainer to try to help him, because I believe that's what diversity looks like. And I believe that when you have somebody that's talented as Mike, knows how to put deals together, that you want to support that. And so for me, it was a no-brainer. And I told him, you got to call Lindsay, you got to call Rich, you got to call Bill, you got to call Rick. You got to call everybody, because everybody got to be on one page. And he did that. He's never going to be scared to work. So before I go any further, I just want to say thank you. I appreciate it. And he always comes in on the dime. So, you know, that's one thing. Secondly, it's just East Liberty Family Health. The work that you've been doing in the community for decades, the way that you've helped so many people, it doesn't go unnoticed. And it's just the way you give back to the community. As a state rep, you know, whenever you guys call, I'll automatically respond because I know the work that you do. So I just want to say I thank you and appreciate you for the work that you do in the community. And I'm going to tell you how it works out, right? And sometimes we take things like this or really don't look into it, is that the partnership created a campus up here that's going to serve a population over there as well as the ones that live here. And so when you can take a campus and turn it into a happy home, you've demonstrated what partnership looks like and why partnerships are important. And so today, I just want to make sure that we understand that, you know, things don't just happen by accident. They happen when people come together to talk about how they can make the community better. And that's what you see today. You see a community that's better because of a partnership between Beacon and between, we say, get it right now, Beacon and East Liberty Family Health. That's powerful.
Yes.
That is powerful. That's going to help our seniors. And then something that we don't even build on that Mike brought up is just with Mary, you know? And you talk about Mary and the fact that she created this for black women and to improve health in the year where black women magic is on a whole nother level, where we just got it justice confirmed, where we continue to see growth. And now you talk about healthcare, and healthcare is right here, where you had a councilman create a new street in her name, in her image, making sure we remember who she is.
Yes.
Today she's smiling and so is her ancestors.
Amen.
And so at the end of the day, I hope we take a nice tour. Have a good time. Told y'all about that East End. We all that.
Okay. And so we come to Councilman Reverend Ricky Burgess. My notes said he's a stalwart supporter, and that's true. But he was more than that in this. You know, supporters point you in the right direction, make a phone call for you. But Ricky, you did more than that. You were a friend, providing counsel, making sure I didn't step in a hole. If I stepped in a hole, and maybe I did, but you helped me along, and that's a different kind of thing. And so you're just getting a few extra words because it's also just true. You know, you deserve it. And so, but just like I said to the mayor, the work goes on, and we're going to continue to lean in, and we're going to call you when it's time to get over some other hump that really only the public can help us get over. Again, because there's no way around it. I could pretend that we are doing this all by ourselves, but that wouldn't be true. So, again, thank you for the work that you've done. And now you have, if you would, a stage to come and have a few words for us.
So, when I came in today, someone asked me, since I've been around a long time, which hat I'm going to have on. You see, for the last 38 years, I've been the pastor of the Nazarene Baptist Church, which is one community over. For the last 31 years, I've been a professor of communications at the Community College of Allegheny County and teach in Homewood, right down the way. And for the last 15 years, I've been a member of City Council, and this, of course, is in my district. I grew up around here. the prettiest girls in Pittsburgh were in Lincoln-Lemington. Come on, say amen, somebody. When I was a boy. And don't tell my wife I dated one. I've been around a long time, and they asked me what hat I'm going to wear, and I've come to the point of my life and my ministry where my role is simply to be a witness to what God can do.
Amen.
You see, I was on the board of Lemington Home. I was on the board when we decided to build the Eva P. Mitchell residence, named after our board chair, Inspector Mitchell, who was a retired officer of the Pittsburgh Borough Police. I was I talked my wife into leaving her nursing job at UPMC to come work here full-time to get their accreditation stuff handled. And so I've been around a long time. For all those old-timers, many of them who are now gone, I want to thank you. Earl, my friend, love you, thank you. Mike and his lovely wife, they're family to me. Thank you for making something special for Black people. Thank you to all. We have a great mayor. I'm so happy that I've lived long enough to see both the first Black president of the United States and what I would never thought I would see as the first Black mayor of the city of Pittsburgh. What God can do. And so we have this building, of which, believe it or not, I can see it from Point Breeze. I live near Dallas and Thomas. I can walk 3 houses and look up and see this building from my home. And so I need to put on the other hat for just a second. Please don't throw tomatoes at me, but you see, there was a time when God's people were in the wilderness. And in the wilderness, they had lots of problems. And there was an incident where they had these poisonous snakes that would come in, these fiery snakes, numbers said, that would bite them, and they would die. But Moses, he took a golden bronze serpent and put it on a staff. That same image, by the way, is also found in Greek mythology. It is the same symbol even today used for medicine. But Moses created the bronze serpent on a staff and put it in the middle of the camp and said that the people would still have to experience the pain of the fiery serpent, but if they looked up to the bronze serpent, they would live. Well, today we now have this new symbol. That's what this is. This is our modern day bronze serpent that here on the hill, from everyone can see it. Yes, we'll still have old age. We're still going to have problems. We still have poverty. We still have gun violence. There's still lots of stuff, right? My knee's hurting today. There's still difficulties, especially as you get old. But in this medical facility, in this housing facility, if we can just look up, we see a symbol of hope and of healing. Yes, we'll go through the problems, but God is not through with us yet. This becomes a place of healing. This becomes a place of wholeness. This becomes a place. So I leave here happy. I go home happy. I promised 15 years ago, there was almost no development in my district. I promised when I ran that I would put, you remember I told you that? I said I would put development into every district that I owned. And we've done Homewood, we've done Walmer, we've done Garfield, we've done East Liberty, and now finally, in a significant way, I promised your mom, I promised her. Where you at, baby? I didn't see you. How you doing? I promised you I'd put something smack dab in your district when you were ward chair. And we've lived long enough to see what God can do. And so I thank you for this moment and just a chance to say, what a great God we serve.
Amen.
Okay, thank you. It's all right on point. So, I was trying to think of like a way of segueing from that to numbers. But the numbers are very, very important, right? This is how we actually implement things. And so, we'll start off, this next section is going to be just the folks who provided the capital to make this happen. And first in the group will be Castor Binion, who is the executive director of the Housing Authority, which, as I said during my earlier comments, provided $3.9 million, 54 project-based vouchers, and is really essentially the lifeblood of this operation. And so we're all thankful for that, and we'll give, in fact, we're so thankful. Some free airtime, advertisements, you earned it. Come on. Yes.
This is tough because the speakers before me, it's hard. However, I take this opportunity to have a commercial. And my commercial is, I want to thank the city leadership, Michael, and everyone about making this happen. But my commercial is that the Housing Authority is always trying to find a way to push affordable housing in the city of Pittsburgh. This system that we set up for this to happen today is unique to Pittsburgh. This is something that we created at the Housing Authority to close the gap. You could have imagination out there. You can come up with guys and girls and create money and come up with organizations, but it's always a gap. And so the Housing Authority came with a system that if you got a 4% tax credit, we're going to work with you to close the gap. And if you have a 9%. So, if your imagination involves affordable housing, come and see me. Thank you.
That was direct. Succinct. Okay, thank you again. So next on our parade of funders is the Urban Redevelopment Authority of Pittsburgh, which I have, a special place in my heart because I basically grew up at the URA. My 20s and most of my 30s were spent at the URA. So I always have high hopes, and the URA certainly delivered in this case. So just a couple quick facts. First, as I said before, the URA was the issuer of the tax-exempt financing. Essentially helped us raise money that has very low interest. And when we use that, we're able to attract something called 4% tax credits or tax credits, so those are sold. We'll talk about that in a moment. But essentially, again, a core part of the financing. And so Greg Flister is the current CEO of the URA. Greg, would you come up and have a few words?
Well, I'm really gratified to see so many media out here today. These are the types of projects that typically you hear on the top of the newscast or the front page of the Business Times. So it's really great to see everybody out here. So it's not the most glamorous project, in some people would say, but I would say that projects like this are vastly important in making the city a more humane and more livable place to be. So what we have here, just to level set, is an affordable, mixed-use and supportive housing development with a healthcare facility actually built in it. What kind of a concept is that? I mean, how long did it take for the real estate industry to figure out how to couple senior housing and healthcare? I mean, thank you for innovating in a very quiet and important way, or re-innovating, I should say. Mary Peck probably the original innovator. It's just an interesting concept and something that makes so much sense, but for the senior housing industry, it's taken so long to figure out. I think we can all agree that the senior housing industry, along with the housing industry in general, is something that's needed disrupting for a very long time. So for too long, we've treated our senior residents as just more poor folks to be warehoused away on the outskirts of town, cut off from the elements of an enriching life, cut off from things like fresh food, places of worship, recreational amenities, access to nature, healthcare facilities, contact with younger generations for whom they can impart a lot of wisdom and who learn a lot from the younger generation as well. So we warehouse these folks off, and it was the wrong thing to do. So this project, while it's very innovative, certainly can't correct all the limitations of its site and correct all the problems of the past, but it definitely goes a long way in doing that and in fixing some of the backward practices of the senior housing industry over the years. It's a fitting homage to the original Lemington Elder Care Services, Mary Peck bond, to provide health care service to elderly Black women. So again, this project is adaptive, it's mixed use, it's affordable, it's supportive. And even though it's not like LEED certified, it's a hell of a lot greener than when it was originally built. You're about a solar roof, there's going to be stormwater management on site. There's transit to the site now where there wasn't before, or there will soon be. So I'd like to congratulate Michael, Earl, who I haven't met yet, and Dara from Beacon Communities for innovating in a very quiet but transformative way in our city. I think it's a really fitting encore to the Navy Residences project that we had a groundbreaking for just a few months ago. And you guys have really become synonymous with projects that are restorative, principles-based, community responsive, and adaptive to the changing needs of our city. So I applaud you for your human-centered, holistic approach to your work. These are the types of projects and developers that the URA takes great pride and wants to support in the future. We're happy and excited at URA about the significant investment we've made in this project, and we're looking for your guys' next trick in our city. Thank you.
We're working on it, Greg. So thank you again. So, next on the roster is Rebecca Yago of Colton Enterprises. But for most of the folks here are not sort of financing nerds, so you've never heard of Colton Enterprises, but you have heard of Dollar Bank. They've been a great partner in the neighborhood community. My health is in good shape, so, but I appreciate it. Thank you. So, I mentioned a while ago, because there's one more financing source, but that would be Redstone Funding Partners. They're on the roster there. They were rained out. So I'll just tell you that they purchased the tax exempt bond that the URA issued of $7 million, which is essentially half of our construction period financing. And then they're providing us with a long-term first mortgage on the order of $4.6 million. So they were also obviously critical in getting things done. So in their absence, thank you, Brian. Closing remarks from my partner, well, not peer, but she's my partner, Dara Cobell, CEO of Beacon Communities. So I haven't said much about Beacon throughout all of this. Others have said thank you. But, Errol and I are the owners of this building, and we get that, yes, it is a difficult thing to create it, right? Risk-filled and all of that, but we were able to line up the partners to do that. But the long-term work of knitting it all together and making a home and making sure that our people are connected to the services that they're going to need. I mean, the reality is that we're serving a vulnerable population, and so it takes people with there's a certain disposition you have to have certain technical knowledge. Weaving all these, we're thanking everyone, and we are, but there is no federal resource or state resource that doesn't come with like a textbook of rules and such that someone has to have a commander. And that means bringing on a very strong property management team, and that's BRM, Beacon Residential Management. Our guys not only manage well, you see all the flowers out there, that wasn't, that was not the construction company. And then there's the work that our guys are going to do, we call it community engagement. Oh, I'll just stop. I will not steal any more of Dara's thunder. Dara, I'm closing the box.
Thanks, Michael. So I was thinking, like, the good thing about speaking last is that everybody's been thanked, everything's been said. The bad thing about speaking last is you follow the mayor and the councilman and the county executive and a senator and a reverend, and so anyway, it's a lot to carry. This is obviously an incredible day to celebrate. First, I do want to recognize Michael's leadership. Many of you may know that Michael worked with Beacon back in the early days at Oak Hill when we were doing a Hope 6 redevelopment there, has had an incredible career, and we are just really grateful to have him as our leader here on the ground in Pittsburgh, doing amazing work throughout Pennsylvania, in Ohio, we hope in DC soon, and we are just honored that he's a part of our team, and he really does lead with creativity and thought and commitment and stick-to-itiveness on a level that, is just fantastic. And he has a great team as well. Jennifer DiNardo and Phil Broaddus are here from his development group who helped execute this project and make it all come together. So I want to add my thanks to all of the funders, all the elected officials supporting this project. We are excited that this is what we hope is one of many, and we do have quite a nice little pipeline going on in Pittsburgh, so there is more to come, and we do have tricks up our sleeve, Greg, so we are excited to bring those to you. I'm also thrilled to have the East Liberty Family Health Center here. To do a project like this, and as everybody has said, to have the services here in the building that will serve the people who are living here is just tremendous, and serve the community and have EBP right next door. We are doing another development like this in South Boston, but just to have the right partner to present this opportunity to have the services is a very unique, special thing. I'm very excited to be a part of that. As Michael alluded to, it's hard work to bring all the money together, to build the building, to oversee the contractor, to deal with interest rates and construction costs and everything else. But really the real work begins, in my mind, when the building is up and running and people move in. And so I want to give a really special shout out to all of the folks who are part of the property management function. We've got folks here from our maintenance team, from our compliance team, from our community engagement team, from sites near and far who have come to celebrate this event with you. So if I could just get my Beacon team to raise their hands and give a wave. Amazing folks, and I will just share two anecdotes. We had someone who was trying to move in this morning, and Sarah was trying to navigate, like wanted to get them in, but we have to, everybody's coming, so it's like the challenges of the day-to-day work. And also, a couple of our maintenance folks were out there mowing the lawn and installing flowers over the last 48 hours. So they really just do everything they can to make this a special place. And ultimately, the work we're doing here is all about the people who live here. I think the Mary Peck Bond story is a tremendous legacy for us to honor here today. I talked to many of you as we were beginning the event, as people were arriving, and I think at least a dozen folks know people who either worked here or were served here as elderly people in this home. So this is clearly an incredible asset in the community, and it's an honor to participate in creating this rebirth. We take great pride in having impact on residents' lives, and we hope that this is just another place where we can demonstrate that commitment, creating a place where people can thrive, can age in place, and we can create a really wonderful impact in this Pittsburgh neighborhood. So thank you all so much for your participation, for your support, and let's cut a ribbon. I think that's the end. So thank you so much.